come in.
Hi, I'm Jen. I'm your nurse today. How are you feeling?
Oh, okay.
Okay. Do you have any
Yeah.
pain at your surgery site?
Not really.
Not really. Okay, that's good. If you had to rate your pain from a scale of 0 to 10, 0 being no pain, 10 being the worst pain in your life, what would you give that pain then?
Maybe 2. Just
Okay.
right where my surgery is.
Oh, okay. Do you mind if I take a look at that hip?
Sure.
Okay, we'll take a look over there. Did you sleep okay last night?
I did.
Okay.
Get a little dizzy when I get up.
Oh, you do? Was that new?
Yeah, well, when they get me up to go to the bathroom or anything, and they
Oh.
just sit me up too fast, that hurt.
Oh, okay.
A little dizzy.
Yeah. Well, you've got some blood in your hemovac. I'm going to go ahead and empty that here in a few minutes, and it looks like you have a little bit on your dressing, so I marked it so I can keep track of that.
Oh, dear.
Yeah. Is it okay if I go ahead and do a quick assessment on you?
Yeah, sure, that's okay.
Okay, I'm going to listen with my stethoscope. All right, and I'm gonna lift up your gown just a little so I can listen to your tummy. Okay? Have you been eating since your surgery? Oh, good. Are you nauseous at all?
No, not nauseous.
Perfect. Do you mind telling me your name and date of birth?
Sophia Potrillo, February 2nd.
Perfect. I'm gonna go ahead and check your pulses too. Looks like you got an IV. And can you wiggle your toes for me? Great.
Yeah, I think I can.
Perfect. Look at those toes go. And can you push on my hands?
Okay.
Great strength. All right, Miss Petrillo. So I have some morning medicine for you, as well as it looks like your hemoglobin levels, which is the amount of blood in your body, has gone down a little bit. And you know what? Sometimes that happens after surgery. We're going to go ahead. The doctor ordered a blood transfusion, so we're going to get that started this morning. Do you have
Oh,
any?
dear.
Yeah. Do you have any questions about that?
I don't think I've ever had one of them before.
Okay. Well, the way we administer the blood is it'll actually go through a special type of tubing into your IV. And then what we'll do is we'll go nice and slow for the first 15 minutes, and I'll stay here with you. We can talk, and I'll just keep an eye on you. And if you're feeling okay after the first 15 minutes, then while the rest of the blood runs in, I'll go ahead and step out the room, and you can get some rest. And it just goes through your IV into your body.
Oh, okay.
Okay.
And everything will be okay?
Everything should be okay. Sometimes there's a reaction that can occur, and we'll keep it. That's why I stay with you for the first 15 minutes, because likely if you are going to have a reaction, it will be pretty soon, early into the transfusion. And we're just going to keep an eye out and make sure that your vital signs don't change, so that your blood pressure doesn't go up, or your heart rate doesn't go up, or your temperature doesn't go up. And we'll see how you feel. So if you don't have any chills or a headache, or you don't get any maybe anxiety or back pain, sometimes those things can occur. And if that's the case, I'll stop the transfusion and I'll notify the physician. And sometimes we just need to give you some Tylenol or some Benadryl And sometimes we might need to just stop altogether. We'll talk about that with the physician. Is that okay?
Okay. Yeah, that's okay.
Okay. So first I'm actually going to give you your medicine, and then while the blood bank is getting your blood ready, and then I'll come in and start your transfusion, okay?
Okay.
So it looks like first up you have your metoprolol and your metformin. So I'm going to go ahead and take your blood pressure. And I'm going to also take your temperature. Can you place that under your tongue? Thank you. Looks good. Temperature is 97.2. And your blood pressure is 103/70. Alright, hold. Let's see, your heart rate. When I counted it, was at 65. Alright. We'll hold if we have the systolic. Okay, so you're good for your metoprolol. And I'm also going to check your blood sugar, and then I'll give you your metformin as well. Do you check your blood sugar at home?
Once in a while.
Oh, okay. Alright, I'm just going to clean your finger with some alcohol. Let that
Okay.
dry.
You can use any finger.
Okay, perfect. Thank you. I'm going to get the strip. And I'm going to come here with our lancet. And I'm going to poke. And I'll wipe our first drop here. And now let me collect the rest. Alright, and we're going to hold that gauze there on our finger.
Blood sugar is 124.
Perfect. Thank you. Your blood sugar is 124. Alright. So I'll give you your metformin today. And then it's not time for your vancomycin yet. So the only other thing would be your enoxaparin. The things that I forgot were a cup. Alright, but you have a lot of drainage in that drain. So I don't think I'm going to give you your enoxaparin right now. I'm just going to go ahead and give you your metformin and your metoprolol. Do you like to take your pills one at a time, or do you want to take them both at once?
Oh, I can take them all at once.
All right. Let me grab your water. There we go. Remember where the cups were, since I forgot mine. All right, I'm going to sit you up just a little bit. And then, you're okay? That hurt your hip?
That did.
All right. I'm going to go ahead. Here's your medicine. Ready? There you go. You can have a sip. Thank you. You want me to lower you back down?
Yes, please.
All right.
They all went down.
Perfect. All right. So, like I I said, I'm not going to give you that shot in your belly because that drain looks pretty full.
Oh, that's good.
Yeah.
I don't like that shot.
Oh, yeah, no, especially in your belly, right? So
Ah.
what I'm going to go out and do is just check and make sure and see if the blood has arrived. And then what's going to happen is I'm going to bring another nurse in with me, and we're going to verify, and we're going to ask you your name and date of birth again, and we're going to look and double check numbers on the blood. This way we make sure that it's the right person getting the right units of blood, and that's one of the ways we help keep you safe and hopefully eliminate any reactions, okay?
Okay.
Okay.
I'll wait here.
Okay. I'll be right back. Hi, Miss Potrillo. I'm back.
Oh, that wasn't too long.
No, it was right there waiting for me. It just came up. Hi, Miss Potrillo. I'm Shannon Burns. I'm the nurse that's going to be helping Jen today. Yeah, remember I told you we're going to do all of that double checking, and then so I can get your blood transfusion started.
Okay.
So first, I'm going to show Shannon. Here are her orders, where we're going to transfuse 1 unit of packed red cells over 3 hours, and then I'll draw her hemoglobin and hematocrit when the transfusion is complete. Okay? There's her unit. All right. There's her name, and I'm going to read to you. All right? All right. And this is Sophia Potrillo, date of birth February 2nd. And she is 85 years old. She's a patient of Dr. Weston, and the only allergies that I have are to penicillin. Okay. All right. And then now we'll go ahead and we'll verify the blood. Okay. All right. So this is for Sophia Potrillo. This is 1 unit of packed red cells. The unit number should be 252-727-30712. Okay. It is O positive. Yes. And it expires 5/5/55, 5,555 years from now. Yes. Woo. Perfect. So we'll verify. Just comping your blood. And Ms. Petrillo, now I'm going to actually scan you. So we like to have a second set of eyes, and then I'm going to scan you. So beep. I'm going to scan the blood. Beep. Perfect. Perfect. Thank you, Shannon.
You're welcome.
All right, so I just took those vital signs. So those are the vital signs that I'm going to use. We should be good there. All right, and now we're just gonna scan our blood. like I only have one channel, so I'll go ahead and stop that here in a minute. Oh, it's all twisted. There we go. Almost there. Alright. I'm just going to go ahead and flush this other IV that you have here. Does that hurt? Just kidding, my IV got twisted. Alright, I'm going to re-clean that. Alright, so that's part one. Now I'm going to go ahead transfusion. All right, Miss Potrillo, I started the blood. We're going to keep an eye on you for a little bit, a few minutes.
Okay.
Make sure that there's not any changes.
Yeah.
Or anything like that.
Could I have another blanket?
Sure.
I'm feeling kind of chilly.
Oh, you're feeling kind of chilly? Yeah.
Yeah.
Well, it's been about 15 minutes, so let me grab another set of vitals, and then I can get you a blanket. All right, so it looks like your blood pressure is about the same. Heart rate's about the same. I'm going to take your temperature again real quick. Can you put that under your tongue?
Beep.
Perfect. All right, temperature's 100.6. I'm going to go ahead and count your pulse real quick, and then I'll go get you that blanket. Looks like we're in good shape. All right, yeah, we're doing good. How's your hip? Do you have any pain?
I'm getting a little headache.
Oh, you are? Okay. All right, so let me get you that blanket, and then now you can rest for the remainder of the time. Oh, I'm going to increase this rate now to now we're going to increase it to 100 because you're doing good. All right, I'll be back, Mrs. Petrillo, with that blanket.
Yeah, don't forget that blanket.
Okay.
I'm really chilly.
Okay, perfect. I'll be right back.